Thank you, Patty and Rachel, for helping me out with that. Okay, and the nursing faculty just came in. Hi, nursing faculty.
Hi.
So anyway, we were, to go back to what we're talking about, I'm on the second slide, if you all relate, so you missed the beginning of it. We were looking over the questions and just want to have just any feedback on the questions about addressing mental health concerns in the classroom. Any concerns right now? What's the comfort level? Sure, on a scale of 1 to 10.
In addressing mental health, is that what you're asking?
Yeah, what's your comfort with when you feel like someone might have some mental health issues, but you're not sure what? What's your comfort level?
A 6.
A 6.
Yeah, 5 to 6.
5 to 6.
Yeah, 5 to 6.
Okay. Okay. So one of the things we want to do today is just look at some of the signs and symptoms of the three biggies we see a lot of: depression, anxiety, ADHD. So if you don't work in mental health or healthcare, sometimes it's just not something that we have knowledge of. So it's good just to have more knowledge so we can identify maybe some things that we're seeing. Okay. So one of the reasons we want to do that is because we're going to look at the numbers. Okay. So let's just take a quick look at numbers. I'm not going to go into detail just for time purposes, but it says by nearly every metric, student mental health is worsening. During the 2021 school year, more than 60% of college students met the criteria for at least one mental health problem. 60%. That's a high number. According to the Healthy Minds study, which collects data from 373 campuses nationwide, and 3/4 of students reported moderate or severe psychological distress. 3/4 of students, okay? So this is why we need to talk about mental health. So again, these are the three that we're going to work on, and we use scales in the clinical setting. So I have handouts here, but I also am going to bring the scales up. By looking at the scales, this is how we assess a patient that comes into a psychiatric setting to see what might be going on. So the PHQ-9 is for depression. The GAD-7 is this stands for generalized anxiety disorder. 7 is a scale. And then I'll just give you some overview of ADHD, okay? So let's start with the PHQ-9, okay? So this is the PHQ-9. So these are some things you might see going on with your students, okay? They may come in and they may just be down. They may seem hopeless, okay? They may be falling asleep in class because they're not sleeping well at home, okay? Little energy. Sometimes they don't eat enough, okay, for various reasons. And then people with depression may feel bad about themselves, low self-esteem issues, not meeting standards of families. Sometimes you hear that, my parents have this certain expectation of me, I'm not meeting that. They have trouble concentrating on things. And then sometimes they're just moving slowly, or they may be a little bit fidgety. And then, of course, our scary one is that they have thoughts that they may be better off dead or hurting themselves. So that self-harm component, or, of course, the worst case scenario is suicidal thought. Okay. So these are some things that people with depression experience. Okay. So when they come into the clinic, we work with this scale to find out exactly where they are on the spectrum. Are they experiencing these things all the time? Are they experiencing things just half the time? And we want to know to get an idea of where they are on the scale of depression. So these are signs and symptoms of depression, okay, which you may see in your students. So this one we probably see quite a bit of is anxiety. So we always hear about test anxiety, right? In the educational world, test anxiety. We also these are more outward things that we may see, where depression are things that we may not see outwardly in the classroom, but these can be obviously more overt in the classroom setting. So feeling nervous, anxious, or on edge. So we always have that students with the shaking leg, right? Or the constant movement, right? They're just kind of like moving their hand or shaking their leg. And they just kind of have an excessive worrying. They're always like worried about things. They may be coming to us all the time because they're just worried all the time, okay? And then they can't control the worrying. They have trouble relaxing, difficulty sitting still, and sometimes they become easily annoyed or irritable. So it may be towards the professor, it may be towards a fellow student. You may see some conflict in the classroom, which I know sometimes we do see that. And then feeling afraid like something awful is going to happen, okay? So this anxiety moves into not being successful on test, not being able to concentrate in the classroom, and the constant worrying. They're so worried about the next test, they can't sit down and actually focus to study because they're so worried about the next test, okay? So that thinking ahead. So we say, if you think ahead too much, you become anxious. If you think about things in the past, sometimes we become depressed. So we try to keep them in the moment, okay? So another signs there. And the other one we see a lot of, and a lot of our students are diagnosed with, is ADHD, okay? This is a common diagnosis in the college crowd. So difficulty, now these are probably things you're definitely going to see overtly. Difficulty multitasking, getting stressed out easily, poor time management, unintentionally interrupting others, sensitivity to rejection, frequent frustration with self, intense mood swings, low self-esteem, and chronic procrastination. So who's seeing these things in the classroom? Show of hands. Yeah, so pretty much everybody's seeing these types of things in the classroom, okay?
So
What's that?
we're in ourselves.
We're in ourselves, yes. We're in ourselves, yes, that is true. So these are the three biggies that college students are diagnosed with: depression, anxiety, and ADHD, okay? So by knowing how they present might help us to better identify what's going on and help us move to a better way of communicating with our students, okay? All right. So as educators, what can we do to help? So first of all, we want to be able to understand what depression, anxiety, and ADHD looks like, okay? And this is what it looks like. And we want to look at, so obviously the behaviors associated with the mental health disorders. So we want to see, so we know what's going on. We know that probably they have depression, anxiety, or ADHD. And sometimes they just tell us, right? We have a lot of students who are very open now, and they'll be like, well, I have ADHD, I have been diagnosed with depression, I've been diagnosed with anxiety, or whatever. You know, they tell us, okay, they want to be transparent with us and let us know what's going on, which is great because then we know what's going on, right? Sometimes too much, right? Sometimes too much, but that's okay because obviously they trust us, right? They want to be transparent or just make us understand like why they may not be performing as they should, which, you know, we want to help them perform in the best way that they can, right? But we want to identify the underlying issue and not really focus on the overt behavior, okay? So if we're seeing anger, we're seeing irritability, I always tell my students when we go through the mental health clinicals, don't look at the behavior, look at what's driving the behavior. So if you look at what's driving the behavior, then it sends a message that I see that something is wrong, like something is not right today. Okay, what's going on? Okay, so you want to make sure that you're focusing more on the need and the emotion and what the challenge is for that particular student instead of looking at that behavior, because then we just react to the behavior. Like if they're being disruptive in class, they're not following rules, they're not turning work in after we continually are instilling these deadlines, and they just continue to not do what they need to do to be successful, right? Okay, so I'll go back to the ground rules for the classroom. So we do want to use therapeutic communication with our students. But one of the ways that this kind of goes a little off topic, but I feel like it's something that Margaret and I have done that has been really successful in the classroom. It helps with self-governance because sometimes when people have different types of mental health challenges in the classroom, they feel isolative. So we always try to make our students feel more engaged with one another, okay? That helps with some of the challenges, some of the anger, irritability, and some of the conflict we see in the classroom, which stems from a lot of mental health issues, okay? So Professor Johnson and I have classroom ground rules for students. So we always begin every single semester with classroom ground rules, okay? So we want to create a self-governance type of situation, okay? So these are just some of the ground rules that we put in place. We talk about phones, side conversations, because they are always a problem in the classroom setting, and we need to make that clear. We also talk about no profanity, and we always talk about listening objectively to peers, and then of course laptop use and not being disruptive to students, okay? So we put these ground rules out there the first day of class, and then we ask the class if we have any other ground rules we should put in place. And a lot of times the students are able to come up with ground rules to be able to put in place. And these are things that as a cohort, some of people in the classroom may have been grappling with for a while, but have been afraid to say something. So we try to have an environment where they can come in and feel comfortable and have this self-governance approach, and make it our classroom, like everybody's classroom, okay? This actually works pretty good. So then when you're communicating with the student later on, you can say, well, our classroom ground rules, let's go back to our classroom ground rules. You know, we said that we weren't going to talk over somebody, or we said we were going to listen, or we said that we were going to not have side conversations, okay? And so this develops a nice relationship with your students, so they know that they can talk to you and they know what the expectation is, okay? So a lot of folks that come in with anxiety and irritability and kind of frustration, so some of those other mental health underlying issues, having this in place has been really helpful in helping us have sort of a very much an environment of everybody feels included and everybody's able to speak and be transparent, okay? So that's just one of the ways we do to help some of the mental health challenges in the classroom, which I think has been pretty successful. So on an individual, so that's more on a group level. On an individual level, we just go back to some basic therapeutic communication, okay? So remember, when you're doing therapeutic communication, is that you don't have to solve their problem, okay? You don't have to solve their problem, because you're not going to solve their problem, okay? Especially if they have anxiety, depression, ADHD, bipolar, whatever they're coming in with. But you need to listen, provide support, and remind them that being successful in the school will help them in the future, okay? So that's about listening, really truly listening, being open and non-judgmental regarding your beliefs about the student, your feelings about the student, or what the underlying mental health issue is, okay? People are reluctant to open up because of feeling judged. It perpetuates the issue and leads to a student being unsuccessful in their educational journey. So mental health stigma is a very debilitating situation for a person who suffers from mental illness. If they do not feel like they can talk to their professor, then they will not be successful, right? Okay, so if they're feeling judged, or if they feel that you have certain beliefs about mental illness, they may not want to speak with you, okay? So a non-judgmental approach is always important. Also, you have to remember, people with mental illness, anxiety, depression, ADHD, they probably spent a lot of time with people who may have been judgmental, who may have not been accepting of their disorder, who may have been telling them, you know, just toughen it up, let's keep moving, whatever, okay? But as the professor, you see this person a lot. So you want to make sure that you're going to be one of those people who are going to be very open to them and listen to them, okay? And I know sometimes students can can give us more information than we want, right? More information that we really want, okay? But just always remember, you're not a therapist. You don't have to be a therapist. And you can say that to them. Like, I hear what you're saying, and I understand that you're really struggling with depression or this or that. I'm not a therapist. I want to hear you. I want to help you in your academic journey. But what can I do to help you further? What resources are out there? Are you getting help? Just things like that. But you don't have to be a therapist, because we're not therapists, we're educators, right? Okay, but they do, because they trust us so much. And they do really rely a lot. Like, we're probably one of for some of them, the most steady thing in their lives, right? We might be one of the most steady thing in their lives. They see us every day. We're consistent, we're structured, we're reliable, we're there, right? We go, I know in the nursing world, we go to clinicals. So we talk a lot, right? Because we're in small groups, we're in the hospital setting. So you might be the only one in their world that they feel a sense of consistency, okay? So just try to remember how you may be perceived by the student, okay? And again, do not focus on the behavior, focus on what is driving the behavior, okay? All right, so Professor Johnson and I are going to do a few role plays. All right, so therapeutic communication. A lot of us have studied it extensively. Some of us, use it somewhat, but not consistently. But there's a lot of good communication skills out there that we can use. I'll go over a few of them at the end. But we're just going to do a few scenarios to let you see what some things we might be saying. And if you're saying some of these things, then you might want to rethink. Maybe we could reword. Okay, that's what we want to do. Can you all see us and hear us okay? Is everybody?
Yes, ma'am.
Just want to make sure they can see us. All right. So you're going to be the educator. Right. You're the student. Okay, so I'm the student. So I'm the student and Professor Johnson is the educator. Okay. Professor Johnson, I know we have that big presentation tomorrow, but I don't feel comfortable speaking in front of the class because everyone judges me.
No one's judging you. Like, I feel like that all the time. You just need to jump in the pool, just dive in.
Okay, so how is that not effective? It's dismissive.
It is, yeah.
It's dismissive. Do you think that's going to make them feel comfortable doing a presentation the next day? No, it's probably going to even add to more. It's probably going to increase the anxiety. If they already have anxiety or depression or ADHD, we're just adding fuel to the fire, right? And getting up in front of the class. So how many of us have said things like that? How many of us have been dismissive? I mean, we all have from time to time, right? So
We try not to be.
we try not to be, we try not to be, right? We try not to be dismissive, especially like we're dismissive. When are we dismissive? We're dismissive like it's the end of class, we're exhausted, we just want to get out of the classroom. We've got a lot to do. We've got grading, all these different things. We have to go to a meeting. So sometimes we don't want to get into a big discussion with the student, okay? So we can say, you know what, I do need to go to a meeting. I'm just going to take a quick break. Why don't you meet me in my office in 10 minutes and we'll talk more about this, okay? So making sure that you're engaging in them and not just being dismissive, okay? All right. So let's see. Let's do one where
We're going to do it the right way.
Let's do it the right way.
Oh,
Okay.
yeah, good.
I'm going to do it the right way now.
Okay.
Okay. Hi, Professor Johnson. I know we have that big presentation coming up tomorrow, and I don't feel comfortable speaking in front of the class because I know everyone is going to be judging me.
Well, that sounds like a really hard feeling to be having right now. Can you tell me a little more about what's worrying you so much?
I can. Yes, so blah, blah, blah. So do you see the difference, right? Do you see the difference? It's just that simple turn of just that little turn, go from dismissive to tell me more, Okay, tell me more, all right?
Oh, and she acknowledged your
That's right.
your
She's
fear
acknowledging
of
us.
getting up there.
Yes, so a lot of it is just about wording. It's just about wording, okay? Making sure you're having that open end, that opened situation where they feel like they can give you information, okay? It's an invitation to tell me more, all right? And then, so when a student expresses stress or fear, responding with validation and curiosity may allow you to capture valuable information and more effectively address the student's needs. So obviously the student is going to do better or feel more confident in the presentation if they know the professor is sort of having their back the next day, right? Okay. All right, so that's one scenario. All right, this is scenario number 2. All right. Scenario number 2. All right. Hey, Professor
Hi,
Johnson.
Mary, how's it going?
Okay, I'm really scared about the midterm test tomorrow.
No worries, you're so smart. I mean, you're like super smart. So, I mean, just study. It'll be fine.
Mhm. How many of us have said that? Or what's on the test? Everything in the book. Everything in the book's on the
You should
test.
be scared. I
So you
don't
should be
teach them the
scared,
test.
right? And for some students, they're okay with that. You know, you can be joking around, right? But other students who may have anxiety, depression, or ADHD, they're going to be like, oh,
We've told you everything you need to know.
right. So that's probably not a good response. But we use these responses all the time, right? All the time, because sometimes we're just kind of frustrated. We're like, we've been over everything. We've, you know, we told you what pages to read. We told you what to do. Like, let's just do this, right? We're just want to get this done sort of feeling, right? So sometimes we get frustrated, all right? So each student is going to, again, as I said, respond differently on what you say. So we need to have responses that work for all students, okay? Because some students have a lot more resilience. They may have a lot more confidence, but students with anxiety, depression, ADHD do not have those things, okay? So we have to remember they don't have those tools in place to help them if we jokingly say things, because for them, that could be very serious, right? So we need to have good, consistent answers for every single student, so we make sure that nobody is going away into a situation and they're not going to be successful the next day. Okay, that's what we want to make sure of. All right, so let's do this the right way. Hey, Professor Johnson. Hey. I'm really scared about the midterm test tomorrow.
Well, I'm not throwing any curveballs on this exam. It's, you know, it's going to be okay. What's scaring you the most?
Okay, so she specifically says to me, what's scaring me the most? And I could say something like, I'm not sure I'm going to be able to finish the test in time, right? We just hear that a lot, right? I'm not sure you're going to be able to finish this test in time, or I'm not sure I'm studying correctly, or whatever. So she's identifying exactly what's going on. So that shows interest, right? Okay, so here is what I say. Our first impulse is to respond with reassurance, so it may feel unnatural to drop that entirely, but also acknowledging and exploring the emotion expressed, okay? So she went right into what the emotion was. What was the emotion? I'm scared, okay? So that's just restating. So you're scared, okay? Tell me more about how you're feeling right now. What's making you scared about the test, okay? So really identifying again, so not giving a lot of false reassurance, oh, you'll be okay, blah, 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 or being dismissive. You want to go for that emotion, okay? If you go for the emotion, the student feels heard and validated, and what you learn from their response may change the way in which you approach the student's learning in the future, okay? So once you identify what the student is scared about or what's making them anxious, okay, then you know, okay, Professor Johnson knows that Mary has this concern about test, okay? So maybe that's something I can work with my student. I know what's going on now, okay? I'm building that rapport with my student. All right, so we have one more scenario. Ready? I think we're doing a great acting job.
Yeah.
Oscars are coming up.
Huh? The Oscars are coming up. All right, good to hear. All right, so I'm coming in, okay. Hey, Professor Johnson, I'm really struggling to finish my work.
You are, oh my gosh, you wouldn't believe the care plans that I have. Like, I have all y'all's from Monday, and now I got Thursday going into the weekend. I mean, welcome to the club. I mean, we all have tons of work to do.
Right. Have we said that?
Not the right way to do it.
Have we said that before, though?
No.
Are you kidding me? I have so much to do. Right, so not the right wording, okay? And honestly, like, sometimes we don't think, oh, I don't say stuff like that, but you do. You do say stuff like that, okay? We're all guilty of saying things like that, all right? But again, you also want to always put the focus on the student, okay? What did Professor Johnson make that about? Herself, okay? It's not about her. You never make it about you. It's always about the student. How can we help the student? How can we identify what's going on? Okay. All right. So this is how we do it the right way. Hi, Professor Johnson.
Welcome back, Mary.
Okay. I'm really struggling to finish my work.
So it sounds like you got a lot going on right now.
Mhm.
What do you think? What do you think's going on with all this?
I'm not sure. So blah, blah, blah. I'm sorry.
Is there anything I can do to help or?
Right. So is there anything I can do to help? Okay. That's offering of yourself, putting yourself out there. Again, trying to identify what's going on with your student, letting you know that you're there for them. Okay. And then that way, they are more likely to talk to you more in the future about what is going on with their situation. Okay. So offering of self and exploring allows for the student to feel heard and encourage the students to open up about the underlying feelings that are perpetuating the behaviors. Okay. All right. So those are just a few things. Am I done? Is that it? I think that's it on our. Did you like our role plays?
Yeah.
We did. Bravo, bravo.
Okay.
What
All right.
about those students though that come to you and you know, like they're habitually wanting to turn in their assignments late and they're using that excuse of.
And so you say, you identify, did somebody say?
Especially with our, stricter grading protocols and.
Right, so you continuously see the bad behavior, it continues
Right.
over and over again, okay? So there's a reason that that's happening, okay?
Right.
Right, so that's the conversation. Instead of being like, you're gonna fail, you're consistently turning your work in late, okay? It seems like we're having this conversation a lot, okay? This is the expectation. You're not meeting the expectation. Tell me about what's going on in your world right now that is preventing you from turning these assignments in, okay? Because obviously something's going on. What is it? What can I help you with? Okay, that's that offering of self where we're presenting the expectation and they know what it is, but we're also saying to them, this is a problem. So what is going on where this is, because you're not going to be, you're not going to be successful if you continue to not turn your work in. But they may say something like, and we hear this all the time. Well, I've been working a lot of the night shifts. Okay, right? You hear that. Or I've been, my kid's been sick. Because this is community college, community being the operative word here, right? And a lot of our students have those issues. So that's where we have to be helping them, right? That's where we want to say, okay, a lot of them come in like, well, I have to work full time and go to school. Okay, all right. So is there any way you can cut hours back? Is there any way, so just like look at what's going on in their world, what's workable for them, what's realistic for them. Okay. That's what you have to do. But you still have to, ground home that they have to meet the deadlines.
So then would it be appropriate to ask them, like I've done this sometimes where if they are having trouble getting things in on time and you say what's going on at work these nights or whatever, and then I will turn it back on them and say, okay, so do you have a plan? When can you get me this paper? Or when you know, what can we do at this point to get your stuff turned in? You know, when do you expect to be able to do that?
So sometimes I would say to them, okay, you know, instead of saying, well, when do you expect, or how are you gonna change this? Let's sit down together, let's see what's going on, let's write out a plan of action. It's a together thing. It's not a me against you thing, it's a together thing, okay? So if you sit down and say, like, sometimes when a student is like really cutting the line at clinical, or they come in without their badge, I make them sit down, I will stay with them an extra 15 or 20 minutes past clinical, and I'll be like, I want you to write a plan out of how you're not gonna forget your badge tomorrow, or whenever you come back, right? So they write out a plan. That's what I have them do. So it looks like I'm engaged with them. I'm like, I'm really worried about you. But you can't just keep telling them and telling them and telling them, because it's not going to work.
Well, you
So-
want them to own it and have choice.
Right.
In what they do, because then they'll be attached to it. They're
And
not
sometimes
attached to
they're
it.
just so, especially if they have ADHD, they're so disorganized. They have things everywhere, you know. Okay, let's get a calendar. Like I have a student I'm getting ready to work with, and we're getting a calendar. Okay, we're getting a calendar, and then we're gonna, you know, then you do the plan of action with them. So it looks like you're engaged with them, and you're really genuinely concerned about them, and you're not just be like, okay, you just got to get turned
Figure it
in.
out on your own.
Right, you're on your own. So I know it seems like a lot, but honestly, like if you just do that like a couple times, then they start getting better, because people that have ADHD, depression, and anxiety, that disorganization piece is huge, okay? So sometimes they just need a little help, just like a teeny bit of help that takes you maybe 20 minutes. And then maybe next time they may be like, hey, I need some help with this, okay? You know, there's so many times students come into your office, and it's not because they, you know, they want some help with academic stuff. A lot of times they come in because they just want to talk to somebody. Somebody's listening, okay? Somebody's listening. And sometimes people that have mental illness, a lot of times they have mental illness because they've never been heard, okay? They've always been dismissed. And so now they're being heard, so they feel like, oh, this is someone I can really reach out to. Again, we're not mental health professionals, we're not therapists, but we are educators, and we are consistent, as I said, we are consistent in their lives. So we definitely want to keep that consistency going, because that's what's going to help them be successful. I mean, that's the way I look at it.
But ultimately, they have to meet the objectives.
But what?
Ultimately,
They have to meet the objectives.
Yes, you never back down from that. You just give them assistance in doing so. I mean, that's what all it is. It's just developing the relationships, right? Developing the relationships. Okay, so I put these out on here, our role plays. Okay. So I'm going back to some of the to the role plays, just we'll connect back in, and some of the techniques. So actively listening is fully concentrating and making an honest effort to understand, okay? So one of the biggest detriments to active listening, and I remember Professor told me about this when I was working on a master's years ago. He said, the biggest detriment to active listening is thinking about what you're going to say next while they're talking. And we do that all the time, right? We're formulating our response in our minds, and then are we listening? No, we're not listening. So you basically have to hang on every word, right? You're listening for understanding, okay? So they're going to talk all over, like some of our students talk all over, right? They're all over the place, right? Just look for those specific little things that you can pull out that are like, oh, this is what's going on, okay? They're talking. Right? And then you just pull that one piece and, oh, this is the issue. Okay, so you have to find out what the issue is by active listening, okay? And it also means, like, if they stop you in the hall, pull them like into your office to talk to them. Because sometimes, you know, I found myself in the hall the other day talking to a student, and they started getting into some personal things. And I'm thinking like, you know, we're in the middle of a hall and they're talking about. So try to move them to either an empty classroom where you can, you know, there's some privacy, or take them to your office, because obviously you don't want anybody hearing any of that, right? Especially other students, okay? Offering a self is offers present interest and a desire to understand. That goes back to not being dismissive, right? Not being dismissive. Or if you notice them in the classroom, so they're in the classroom, right? And you notice they're one of those students, you know, you always have you might have a student, they're kind of isolated from the group, right? They don't really, either they don't know how, you know, so they may have like autism, they may be on the spectrum, or again, it may be depression or anxiety, like social anxiety type situation. And they're kind of isolated, right? And you notice them in your classroom. Well, you don't want to go all semester and not connect with them, right? You don't want to not connect with them because clearly they're struggling. They're struggling, right? So there's nothing wrong with just saying, hey, how you doing? How'd class go today? What's going on? Just kind of get to know them. You know, let them know you're there for them. Or if someone is coming in and they're agitated, okay, or they're just a little more rambunctious than they usually are, same thing. There's nothing wrong with checking in. Okay, hey, what's going on? I noticed you seemed a little irritable today. What's going on? Okay, and they may be like, you know, I just had this horrible morning. Okay, I had a horrible morning. And then, of course, that's the offering, the general leads. That is in letting the student take the direction. So one of the scenarios was, she just said, how can I help? Well, that's back on the student. That student needs to communicate to you what you can do to help. I'm here to help you, how can I help? Okay, that's putting it back on the student so they let you know. And basically just restating is a great one. Okay, so you don't have to don't ever give them advice. You're going to give them guidance, but guidance is more of like using the therapeutic technique, having them restate, having them sort of come to the understanding of what's going on, where advice is like, I think you should do this, this, and this. Okay, guidance is helping them learn about, helping them figure out in their minds, okay, this is not working with your guidance. What do I need to do to improve this situation? Okay. So restating is a beautiful tool. I use it all the time at the psych hospitals, all the time. So what you're saying, or a clarification, what you're saying is this, okay? So you're struggling with your work, you just restate it with the, right? Okay, and they'll be like, yeah, I am. Well, tell me more. I want to hear about this. I'm really concerned about this because we want you to be successful. So tell me, how are you struggling with your work? Okay, keep that really open to them, okay? So restating is like one I use all the time. And then of course, offering a self and active listening. Restating is great. And there's a couple more here. Okay. And then of course, validating, which I think you had mentioned, is we always want to validate. Again, go back to the emotion, go back to the feeling, validate that. That lets the student know she gets what I'm going through right now. Okay? Okay, I'm feeling really angry today. So you're feeling really angry today. Okay, just repeating that back to the student. They know like, okay, oh, she heard me. She knows I'm feeling angry. And then you go back with, what's making you angry today? That's it. That's all you have to do. It's so simple. It's not that hard, okay? So like Professor Johnson said to me, that's a tough feeling to have. Okay, recognizing and validating, okay? Of course, exploring is another good one. Just the same thing I was saying before. What is scaring you the most? Tell me more. I'm curious, what's going on in your world that leads you to struggle with your work? Okay, what's going on with you that's causing you to struggle? Okay, and then any kind of encouraging description of perception increases your understanding of the student's perception. So talking about feelings and difficulties can lessen the need to act them out inappropriately. So if you are engaging with your students and they know you're there for them, they're less likely to act out. Because a lot of people, especially more of the adolescent, so we have some students that are like I mean, I have one in my class right now, she's 20, okay? So they're young, and so depression actually comes out as like aggressive type behavior, irritability, and anger. That's actually depression sometimes, okay? So if you're working on the feelings, talking to your students, it's less likely they're going to act out in class because you're building that therapeutic rapport with them, which also builds respect. Okay, so if the student respects you, it's less likely they're going to act out in your classroom. Right? So just engaging well. And of course, summarize everything that's going on and then build your plan of action with the student. What are we going to do next? Okay. Because if you keep going back to this behavior is not acceptable, it's not acceptable, you have to go back to, all right, what are we going to do to change this? And then you're going to focus on the feelings. It's okay to have those feelings, but those feelings are not going to make you successful. So we got to work on those feelings, right? Okay. Because they're detrimental to your success. All right. Go back to the feelings. Okay. All right, and of course, campus resources are so important for students, okay? So again, we're gonna have a lot of students who are gonna talk to us about things we're just not sure of. We're not sure how to address them. Sometimes they may say things to us that you're kind of like, should I report this, not report this? What do I do with this, okay? So again, obviously, work with your colleagues without breaking FERPA, of course. But always go back to your resources, okay? So let's just look at these. I'm not sure if everybody knows where these are.
Mary, do you ever ask a student if they're suicidal?
Here on campus, no, I have not.
I had to once.
But if you feel like that's definitely
That's scary.
something that,
I have, but I always cringe whenever I ask it.
what
Just
did
do it
you
last
do? What did
semester,
you do
yeah.
after you asked them?
I had a student last semester.
Okay.
And he would consistently not turn in his homework, fall asleep, poor grades, or he just wouldn't show up. And time again, you know, he would share too much in the classroom. But I talked to him a couple times, and at one point I did bring him into the office and I said, you know, what's going on with you? You're struggling, your grades aren't good.
You met me in the elevator.
Yeah,
And he told
and
me,
he
he
said something to Dawn.
said he wasn't doing very well today. I said, can you tell me what that means?
Yeah, that's a good,
You know.
that's an excellent question.
You know,
Yeah.
but he really couldn't put it into words, and he had such a flat affect and was
And then he had,
just not right that I went and I knew Natalie was working with him. And so I mentioned, I'm like, I don't know what's going on with him, but in the elevator, you know, he shared with me, he's not doing well. So I don't know what that means. You didn't ever get to that with me on the elevator. But I thought it should at least be explored, and Natalie had a relationship with him.
Yeah, it definitely needs to be explored always. So
Yeah.
what did you end up doing?
so he came into my office and I did, and I said, you know, you're exhibiting these signs that make me nervous. You know, I have to ask you. I would do you a disservice if I didn't ask you.
Mhm.
You have thoughts of harming yourself or anyone else? And thank goodness he said no. He said,
Oh,
I have
okay.
in the past and I've been treated for it in the
Okay.
past, but no, not at this moment. But, and then he and I had talked about, he was struggling with how to tell his parents he wasn't gonna be successful
Mhm.
in the program. And so I even offered, you know, we can role play if you want.
Yeah, and that's good. Role playing is great.
But he
It
never,
works
he
well.
never took me up on it.
He didn't take you up on it. Okay. Yeah, I mean, if you do suspect, obviously you want to ask that question, but there are resources out here at Reynolds that we need to tap into for those specific situations.
I did talk to him about timely care.
Yeah. Timely care. This is something I don't know how long this has been here, but this, meditation and prayer rooms are now open on the Parham Road and downtown campus.
Is there,
Oh,
You gotta like stop share and then, oh,
That's
yeah,
where-
yeah.
It's not very savvy with
That's
my
okay.
PowerPoint. Okay. So I just, I've actually been using this recently, the meditation and prayer rooms, and I think this is great. I saw this. And if students just need a moment, a place to be where it's quiet. I've referred a couple students down there already. I don't know if you guys knew about this or not, but it looks like Parham Road is 235, and then downtown is room 120, which I think is great. So that's there. So even if your student is having a little bit of difficult time, you may want to say, you want to go hang out in the meditation room while we're on break. Just let them bring their thoughts back together. So I think this is great. I don't know if anybody has referred anybody down there, but I know I've. So that's a really good one that I've been using. Of course, we all know about timely care. That's one we definitely want to be using, okay? There's report a concern, okay? There's also a lot of information here about what may be a concerning behavior, and then what would happen next, and of course, our behavioral intervention team, okay? So the information is here if we need it, okay? And it's under, I don't know my PowerPoint, but it's in the PowerPoint. But definitely, yeah, I mean, if you're ever feeling like the student is saying anything that vaguely is leading to, you think it may be something where they may hurt themselves or others, obviously, yes, we need to ask that question. And that's how we ask it in the psych world. Are you having any thoughts of harming yourself or others? Okay. That's kind of the way we ask it.
Did you ever, if you would have said yes, are you calling 911?
Well, that's when you do the report of concern. Yeah.
You could certainly explore it more.
Is that the behavioral intervention?
But you don't let them leave.
Yeah, you don't let them leave.
Don't let them leave.
You don't let them leave, and you need to get the specialist up the behavioral intervention team. But, I mean, you know, it definitely can happen, so, and it's definitely your situation, Natalie says that it actually can happen. So what other things do we have going on that are concerning, or your concerns about the mental health issues that are now coming across our schools in full force?
You just never know.
If I have somebody sitting in my office saying they're gonna harm themselves, I think I'm calling 911, because I don't think the behavioral intervention form is gonna happen in a timely fashion.
Right, but I think at that point, you don't want to leave them alone.
Yeah, you did it all, but
I mean, actually,
I'm probably gonna knock on Natalie's door to have her call 911, but I'm gonna see that, yeah.
Yeah, you
But I'm, the
definitely,
behavioral intervention form,
don't want to leave them alone, but then, I mean, you're right there near Miss Gunn, so you would probably go see Miss Gunn.
no, I'm not on Natalie's.
so,
Natalie go.
so would we ever just walk them over to the VCU PD?
That's my thought.
I'd be afraid I'd lose
Honestly,
them.
I don't really
No.
know the specific protocol for the behavioral response team.
I'm
Patty's
afraid I'd
here.
lose them.
Patty,
Yes, so I put in the chat, the one thing that you
I
can
don't
do
think I'd wanna
is,
walk anybody.
No, we
They'd
wouldn't
probably
walk.
jump out in front of a car.
Can
It
you
just
hear
says
me?
you're responsible, so I don't think I would.
you
do that.
notify the campus police clearly, and then they're probably part of that response team.
Yeah.
But you would never walk them over on your
No,
own, no.
I'd look into it.
Because no, but the biggest thing is you don't ever leave them alone. Like, once they make that statement, you never leave them alone. Never.
Yeah, not here. I have had a student before, in skills lab. She had a massive panic attack right in the middle of her return demonstration. And when it was over, I talked to her, you know, what's going on, blah, blah, blah. She told me that she was suicidal, but we had an on-site counselor, so
Yeah.
I was able to walk her to the counselor.
Okay.
And then the counselor, ended up talking her into, admitting herself.
Okay. Yeah.
It's fully happens. Okay, Jerry.
But yeah, I mean, it's always a, what do I do if they say yes?
Well, one thing that came to mind with the active listening too is, because I'm guilty myself, tasking. And so I think, like you said, you have to, whatever you're doing, put it down and really actively listen.
Yeah,
Because I catch myself, even not just even with students, just in life in general, but
yeah.
just really focusing on what their conversation is. And like you said, trying to pull out those keywords so that you can restate something
Yeah.
back. So I think that's.
And I think the biggest thing is like, we have to be comfortable with people who have mental health issues. As educators, we have to be comfortable because they're out there.
Right.
So, I mean, especially on college campuses now. So we have to learn to not be like doing other things because or being dismissive because we're uncomfortable, right? We have to be comfortable. That's the biggest thing. So, because it's getting worse, sadly. And a lot of students now are having difficulty getting services because all the services are saturated, especially some of them don't have insurance. So you might have to wait a month to get in to see a provider, okay? So then you're struggling for an entire month, or then you might start doing other things to help you with your symptoms, which may not be so healthy. So then we have those concerns as well. But that's why we have to be comfortable with working with students who have mental health issues, okay? And like I said, I think the most, unless you all are seeing other things, but mostly I'm seeing panic, anxiety, depression, and a lot of ADHD. Is anybody seeing anything else in their classrooms right now? I mean, any other?
I'm not really seeing aggression, but that's really always on the back of my mind.
Some conflict. There's definitely some conflict sometimes with students, amongst students in classrooms. You see that a little bit. But again, that's probably the underlying is probably anxiety or depression, and that's how it's coming to fruition,
Manifesting.
right? So that's what I'm saying. You're seeing that, but then you have to think, instead of seeing that as that, oh, that student's aggressive, or they're inappropriate, or they're, agitated or irritable, then you think like, instead of thinking like that, you're going to think like, something's going on there. What's going on, right? Because we don't want to be labeling them, right? Because that doesn't do anything except create more in your mind that they're just a difficult student, right?
Well, and I think that the current, we don't know if we have funding. We don't know what some of the signatures mean, for funding, or if you have alternative to his lifestyle, and some of the things he said, it can cause more anxiety and more, even just thinking about what might happen, even, or what, what your passport says, or all of that can just cause you more and more anxiety. There's been so many non-traditional things that he's talked about. And I think that's just going to increase anxiety, not just test anxiety.
Yeah, absolutely.
Just for the,
Absolutely.
that you don't know, the not knowing.
Right.
Because what's been promoted has been a very traditional everything. And then the whole taking away funding of everything.
Yeah.
Everything funding.
So there's a lot of anxiety. I mean, we all know there's so many things causing anxiety these days. So many, it's endless. It's endless.
Not just
And
our test.
they're bringing all of that outside world into our classrooms. And
You gotta
they need
test
our-
tomorrow.
They need our consistency and structure, right? Okay. So, I don't want to go over, so, any questions, concerns at this time?
Thank you.
You're welcome. Thank you.